Hello. Good afternoon, everyone, and welcome to our scientific session. I'm Dr. Narendra Kumar, Head of Global Medical Affairs at JEISYS. Before starting the scientific session, I just want to give a very, very brief introduction about JEISYS, what we do, how we do, and why we feel very proud of the work which we are carrying out. Now, JEISYS is a company which is founded on the principle of science. And within the organization, we have a very strong belief that science breeds science. That means the more we research, more research questions comes in, and then we go back to the lab and we try to find out answers to those research questions. Now, this is how science grows. And at JEISYS, we have taken this responsibility that as an organization, we are going to grow the understanding and science behind radio frequency devices as well as HIFU devices. That is why, if you look at the number of patents which we have, currently, like till yesterday, we have 420 patents. And our patents are not only in one country, but we do have global patents on various innovations which we have brought to radio frequency devices as well as HIFU. If you look at our scientific productivity, quite often people say that the companies are spending so much money in research and development, and what is the productivity? Now, the productivity of research and development are measured in two ways. How well you innovate new technology or new ways of doing things, as well as how productive you are in putting your innovations into scientific publications and make it available for your colleagues across the globe to read it, critique it, cite it in their research. Just to give you confidence that in last 18 months, we have completed more than 25 projects, and we got all our works published in SCI grade journals. How we have been able to do this? We have been able to do this because at JEISYS, we believe in design thinking. The work which we are doing, whether it is writing and publication or working on our technology, is very much driven with design thinking. And that is why our speed to innovation is very, very fast. And then we also ensure that when we innovate, our speed from innovation to reaching to the market should also be minimized. So we innovate, and then very quickly, in a very short span of time, we try to bring our innovations in your hand so that you can optimize your patient's outcome. Today, in this scientific session, we have invited global thought leaders who are going to discuss some of our technologies, and they do not need any introduction. They are very well known in the community. To begin the scientific session, I'm going to invite the moderator for the session, Dr. Kentaro Oku. He is a dermatologist from Japan. He is a sought-after speaker in various congresses globally. Quite often I make a joke with Dr. Oku that we meet more often in the meetings than meeting in the clinics. He is so in demand. You can see him at every global platform speaking and sharing his work. So let's welcome Dr. Oku to moderate the session.
Thank you, Narendra. Thank you.
Over to you.
Yeah, thank you. Thank you for a kind invitation of mine. I'm Dr. Kentaro Oku, and the moderator of the session. It's a great honor to serve as a moderator in a JEISYS scientific session. We have 2 or 3 fascinating issues about density, potenza, and of course leniency. So let's get started about the scientific session. The first session is the synergistic hybrid RF from innovation to clinical excellence in skin tightening with the density alpha tip. Please welcome Dr. Chan-Sik Kim.
Kim. I'm at Chang Dermatology Clinic in Seoul, Korea. So I'm very happy to present here today. Thank you for inviting me to JEISYS Medical. Where is this one?
Yep.
Okay. Okay, density was launched 3 years ago in Korea. At the beginning, it was used with the two tips, the high tip and classic tip. Now, the alpha tip was launched earlier this year. It uses JEISYS' own technology, the monopolar and bipolar combined RF. In sequential pulse heating algorithm, the monopolar RF delivers energy in 3 pulses. Bipolar RF then follows in 2 pulses. Previous high-tip RF, the 4 monopolar pulses and 1 bipolar pulses. But this, with alpha tip, it can deliver energy, monopolar energy in 3 pulses, enough energy in 3 pulses, and strengthening the bipolar energy. Compare the 3 types of RF mode. Monopolar gives deep volumetric heating from the reticular dermis to fascial layer with gradual, long-lasting improvement. Bipolar gives shallow heating of the papillary dermis heating with an immediate effect. The mono plus bi hybrid mode combines both, covering upper and lower dermis down to the deep facial layer, delivering an immediate effect plus continued improvement of over 6 months. This animal study shows the evidence for which sequence works better when monopolar and bipolar RF combined. It was done in aged mouse model using a Potenza diamond tip of JEISYS Medical. They compared 4 sequences, mono-mono, mono-bi, bi-mono, and bi-bi. The monopolar to bipolar sequence gave the best result. With a single treatment, it raised collagen fiber density by 76%, and elastin fiber density by 82% over baseline. This study used density classic tip and high tip on mouse skin. Both tips increased collagen and elastin in the aged mouse skin. But the effect was greater with the mono by high tip. Collagen density rose 1.8-fold with monopolar RF and 2.4-fold with the hybrid mono by RF. Elastin fiber expression was also higher in the monopolar bipolar group. So on density platform, both tips are effective, but the sequential mono-bi delivers the stronger result. The classic tip is the conventional monopolar RF with a single electrode. The high tip and the alpha tip use sequential mono-bi pulse technology with 2 electrodes. But the alpha tip's electrode area is about twice as large as that of the high tip. So the alpha tip delivers energy deeper and wider. It also delivers energy uniformly across the tip, and it allows for faster treatment. Now, let's discuss the key advantages of the alpha tip. The first feature is deeper energy delivery. These images show energy delivery of the 3 kinds of tip. When the total fluence is the same, the red high temperature zone reaches down to about 3 millimeters with the classic tip. With the high tip, it reaches about 2.5 millimeters. And with the alpha tip, it reaches deeper, down to around 4 millimeters. You can also see that compared to the high tip, where the heat is concentrated around the electrode, the alpha tip spread the heat much more uniformly. In the sequential hybrid pulse, bipolar RF mainly targets on the superficial layer, while monopolar RF reaches the deeper layer. Together, they create a synergistic effect. In the papillary dermis, RF energy induces collagen contraction and stimulates new collagen synthesis. As the dermis becomes denser, the skin looks smoother and brighter right after treatment. It also accelerates epidermal turnover and pore tightening. In the reticular dermis, monopolar RF induces same collagen effect, but here the energy goes down deeper along the fibrous septa and the retaining ligaments. This strengthens the skin support structure and leads to long-lasting skin tightening. The key is electrical conductivity. Fibrous tissue conduct current better than fat tissue, so it tends to travel along the fibrous septa and the retaining ligament, rather than through the fat. You can see the thermal image. First, the RF energy travels along the high conductivity fibrous septa. Then heat starts to build up and spread along these septa. And finally, the heat diffuses widely into the surrounding fat. In this way, RF uses the fibrous septa and ligament as pathway to reach the deeper support structure, which is exactly what you want for long-lasting tightening. This porcine study using the alpha tip shows the change in the fibrous septa before and after treatment. If you look at the boxed area in the fat layer, you can see that the fibrous septa became both thicker and denser after treatment. On average, the thickness roughly doubled. This tells us the new collagen formed within the fibrous septa, the structures that support the skin. Contracted, thickened septa pull in surrounding fat tissue, driving overall tissue tightening. The alpha tip delivers energy over a wider area. Each RF delivery width 16.5 millimeters. That's 2.5 millimeters wider than the monopolar classic tip and 5 millimeters wider than the high tip. And when we convert the thermal images into pixels to calculate the area, alpha tip forms a thermal pack about 3 times larger than the high tip. The alpha tip also delivers energy uniformly across the entire tip. With the classic tip, there's a difference in heat between the edge and the center. And with the high tip, the heat concentrates around the 2 electrodes. So this creates temperature variation and uneven energy distribution. But the alpha tip minimizes the temperature variation between the bipolar electrode and spread the uniform energy across the tip frame. This creates what we call a thermal top hat mode. By delivering energy uniformly, we can improve safety and achieve a more even clinical effect. For each tip, they measure the temperature change 1 millimeter below the electrode during RF delivery. With the high tip, the temperature difference between the center and the electrode area was up to about 5 degrees Celsius. But with the alpha tip, you can see almost no difference between the center and the electrode area. With the high tip, the smaller electrode area may carry some risk of surface damage. But the alpha tip with larger electrode reduces the temperature variation between electrode and improves safety. The density alpha tip also allows for faster treatment. The time per single shot has been reduced from 1,200 milliseconds to 940 milliseconds. In actual treatment with a full 600 shots, the total treatment time can be reduced from about 40 minutes to about 30 minutes. In my practice, it usually takes about 25 minutes. So the alpha tip is also time efficient. Density delivers consistent energy through real-time impedance calibration. This technology is built into every tip, including the alpha tip. Skin impedance varies by individual and skin conditions, so actual delivered energy may differ from the target energy. This technology automatically measures changes in skin impedance and instantly adjusts the output, so the set energy is delivered consistently. They compare the energy output across different impedance levels. Each line shows a different skin impedance. On the left, without calibration, the power output lines separate as the impedance changes. So the delivered energy becomes uneven. In the middle is density. Each line stays close together with minimal variation, just like the original T product. So even when the impedance changes with skin condition, density can maintain stable and uniform energy delivery. That means treatment result can be more consistent and predictable. Density also has a smooth and adjustable cooling system. This helps deliver RF energy deeper, more safely. The cooling has 5 levels, and you can control it separately from the RF. So we can optimize the cooling for each treatment. You can also use the cooling alone without applying RF whenever you need it. With the alpha tip, 10 cooling pulses are spread across 3 stages, 2 pulses in the pre-cooling stage, 6 pulses during RF delivery, and 2 pulses in post-cooling. This provides more efficient cooling compared with previous tips. When it comes to pain and heat sensation, the alpha tip is much more comfortable than the classic tip. But it can feel slightly stronger than the high tip, but that's because the electrode is much larger. This allows the energy to be delivered deeper and wider, more energy in one shot. Let's look at some studies on density. As the alpha tip was just launched this year, no published data are available yet. So let's look at the existing studies using previous tips. In this study from Korea, 32 patients received a single treatment session using the density classic tip. On the left, you can see clearer jawline and softer nasolabial fold. The objective measurement also supports these changes. Skin radiance improved at 4 and 8 weeks. Oiliness decreased at 8 and 24 weeks. Skin elasticity improved as well, with better viscoelasticity and reduced retraction time. The biopsies also show more collagen and more elastic fibers, and smaller sebaceous gland. This case series from Taiwan included 5 patients treated with the density high tip, the monopolar plus bipolar sequential RF. At energy level 4.5 to 5, which is quite high, all 5 showed clearer clinical effect. Improved skin elasticity, smoother texture, better contour, reduced wrinkles, and less visible pores. This study comes from Dr. Kentaro Oku, the chair of this session. In 16 patients, he used monobi cross-lift technique with density high tip and measured the change in 2 directions, horizontal and vertical contraction. The results were clear in both. The horizontal change reflects skin tightening, and the vertical change reflects contour improvement. These treatments showed good results in both directions. Let me show you a few of my own case. I used density alpha tip. This is 70-year-old patient. The photo after 1 week, you can see the skin looks tighter and texture smoother. The complexion looks brighter. It is good case, show the immediate effect of density alpha tip. 37-year-old female patient. 1 month after, the facial contour appears more defined with visibly lifted jawline. The skin texture and redness have also improved. 44-year-old woman. 1 month after, although the change is not dramatic in the photo, but you can see her facial lines, it looks slightly more defined. Now, those are the main reasons why I use density in my practice. For me, density is not only a lifting, tightening device. It can improve several aspects of skin quality at the same time. First, we can see immediate skin tightening as well as improved skin texture and radiance after the treatment. The skin often looks firmer, smoother, brighter. Second, over time, density helps new collagen production. It leads to long-lasting lifting and tightening, wrinkle improvement, and also pore tightening. And the alpha tip improved safety with stable and consistent energy delivery, as well as effective cooling. I also like density alpha tip because of minimal pain and discomfort during treatment. The treatment time is shorter than other RF devices. So in my practice, density is a very useful device for improving both facial tightening and skin quality improvement. This is my treatment plan using density in my clinic. While density alone can provide good results, I often combine it with other procedures to further enhance the outcome and improve patient satisfaction. In my practice, the most common combination is density with HIFU to achieve stronger lifting effect. In some cases, I also combine density with biostimulators such as Juvelook or Sculptra to further enhance collagen stimulation. For overall skin improvement, I recommend program over 8 to 12 weeks. Each 4-week cycle includes density 300 shots, laser toning, the Potenza pumping tip with a biostimulator, then laser toning again. I repeat it for 2 to 3 cycles to improve overall skin quality. These days, the market is crowded with many RF devices, but density alpha tip is special for 3 reasons. First, a proven mechanism-driven effect. It is based on proprietary sequential hybrid RF mechanism. Second, immediately perceptible result. Patient can feel and see the improvement right after the treatment. And third, it's comfortable for both physicians and patient with enhanced safety, less pain, or shorter treatment time. Thank you for listening.
Thank you. Thank you, Dr. Kim, for the scientific and insightful presentation about your technique and clinical result. Okay, the next session would be, sorry, would you please turn on? Okay. Sorry to wait you. Next session would be the Dr. Yuri. Yeah, he is a very good friend of mine, and he is a so sophisticated international doctor. So please welcome Dr. Yuri.
Thank you. Thank you, Dr. Oku, for your kind introductions. Thank you for the invitation from the JEISYS to speak in CAS Asia. So my name is Yuri. I'm a board-certified dermatologist and dermatologic surgeon from Jakarta, Indonesia. And today I will share about one of the most interesting one novel indication from the energy-based devices. It's about the fat proliferation. So we want to increase some volume using the energy-based devices. As we all know that one of the mainstay treatment for the hollowness and the indentation is using the injectables. But now we have hope. We have some some evidence base to increase the volume using the energy-based devices. Okay, let's start with the chronological aging. So we, the human being, will experience the aging process, and we all know that when we become older, it's not only the superficial layer, but also a deeper layers in the subcutaneous tissue that affected. And we all know that starting mid-20s or early 30s, usually there are some maldistribution of the fat. We could see there's some jowling, there's some accumulation of the fat, but also there's some the indentation of the hollowness, usually in the mid-cheek or also in the temporal area. So this kind of conditions will become severe when we become older, like 40 and 50. And usually for the indentation or the hollowness, we use the injectables like the cross-linked hyaluronic acid or now the biostimulators and also some skin booster like PN, PDRN, and etc. But most of the people is afraid of the injectables. We need to honor our patients, their fear of the needles, the pain, and also the injectables. And they're also afraid of side effects, and also the unnatural look. And to date, as we all know, there are no a laser or the energy-based device to increase the volume. And most of laser energy-based device, we treat the pigmentation, vascularizations, and for the skin tightening. I use many devices, and we all know, almost is for only not for increase the volume. And there's some machine or devices that can target a deeper layer of the skin. And one of them is the HIFU devices. This is, we could see that the HIFU device is using the acoustic energy and target the deeper layers. So the unique and the specific about the HIFU is they can target specific layer and depend on the spot size. We can set the spot size, and now with the newer generation of the high intensity focused ultrasound, we can have so many spot size and we can target depend on our specific target. And this is if we compare the HIFU technology with the another laser or energy-based devices, the HIFU can go deeper. and maybe the deepest with the energy-based devices. And the good things about the HIFU is it can like bypass the epidermis. We all know, especially the Asian skin is prone to the PIA, so the post-inflammatory hyperpigmentation. So it can like bypass the epidermis and go deeper into the papillodermis and the subcutaneous tissue. So it will be safe in our Asian skin. And with the next generations of the HIFU technology, now we have so many spot size that we can choose. So we can select like for the superficial layer of the dermis, usually we use like the small spot size, like 1.5 or 2 millimeter. But if you want to target a deeper layer, so you can choose the bigger spot size. And beside the spot size, we also have like now the dot and the linear. There's some machine have not only that can deliver the energy, it's not only the dot, but also like the true linear shot. And in my practice now, I like the linear shot because I can do the faster treatment and I can have the wider treatment range with the linear one. And as we all know, the primary mechanisms of like the high intensity focused ultrasound is the collagen remodeling, and we have also some evidence for the local lipolysis. And this is like the usual cause for the skin tightening. Usually I use the multi-layer technique. I use multiple spot size to treat my patients. Like this patient, I use spot size 4.5 for the skin tightening in the lower face, and for the whole face, I use the 2 millimeter spot size to target the dermal layers. And this is the result from 1 month and after 3 months. And one of the new interesting in the experimental studies, we found that the HIFU technology can also treat the adipogenesis. It can increase the fat proliferation, so it means we can increase the volume using the energy-based devices. And as we all know, when the skin aging, there's some like a reduction in the subcutaneous adipose tissue and the adipose-derived stem cells. And when using the high-intensity focused ultrasound, we all know it can target a deeper layer. This is like the evidence that the HIFU technology can target the deeper layer. The brown spot is in the subcutaneous layer, so it can go deep with the HIFU technology. And from the molecular studies, from the experimental studies, we have found that the HIFU can increase a good marker and reduce the bad marker. And one of the most important marker is the heat shock protein 70. And this heat shock protein like can proliferate the tissue, and how they can proliferate the subcutaneous layer. First, this is the pathway. So when we increase the heat shock protein 70, it can reduce the inflammatory marker, like the interleukin 6, the tumor necrosis alpha, and the NF-kappa beta. And when it reduces the inflammation, in our fat cells, there are some cilia, and this is like when there's some inflammation, the cilia will become like downgrading. But when there's, if we reduce the inflammation, so the cilia can work very well. And then after that, they will increase like the PPR gamma and the CP alpha. This is the master regulator of the adipogenesis. So when we increase the PPR gamma and the CP alpha, it can increase the proliferations of the subcutaneous tissue layer. And we found with the specific marker, there's some increase the heat shock protein 70 and reduce the PPR alpha, increase the PPR alpha and increase the CP alpha. This is the master regulator of the fat cells, and the highest in day 1, and then it will reduce with time. And we also found that we can see the adipose number tissue is increased, and also the thickness of the subcutaneous layer. And we found there are many studies about the temperature and the treatment effect of the peripheral tissue. And we could say we don't need a high temperature to regenerate or to increase the collagen remodeling. We need like around 40 degrees. And using the lower energy settings like the 0.2 joule, we can heat the tissue around 40 degrees. So if our target is for the lipolysis or the sculpting, it will be a higher degree, around 65 to 70. So if you want to do range rate, usually we just use the lower setting, around 0.2 joule. And this is our technique. So the most important thing is we need a marking when we do like in the clinical setting, because we need to mark which one is the indentation and the hollowness, and then which one for the skin tightening or for lipolysis. Usually, I use the marking first for our patient, especially in the older patients, because we know there are some many maldistribution of the fat. So some patient in mid-cheek might have some indentations, but on the lower face might have need for skin tightening or lipolysis. And after that, we need to choose the right like spot size. With these next generations of the high intensity focused ultrasound, now we can set like the spot size from 1.5 until 13 millimeter. So we have a very wide range of the spot size, and the spot size have a correlation with the target depth. So if we, like I said before, that if we want to target the superficial dermal layer, we choose like only 1.5 or 2 millimeter. But if we want to target a deeper tissue, for the subcutaneous, we use 3 millimeter or 4.5. And for a deeper, like in the body, usually we use 6 or 9 or 13. And then after that, usually I only use usually one vertical and one horizontal pass. I don't do like too many multiple pass because I'm afraid of the overlapping and can lead to burn. And usually using the lowest energy setting, around 0.2 joule, the thermal sensation is only warm. Some patients can only feel warm, and we cannot see the erythema. And usually in the practice, I use also the ultrasound just to make sure which one is the appropriate spot size. We can measure with the ultrasound. And this is one of my case. This patient have like the hollowness in the temporal area. So I plan to use to treat the temporal with multiple spot size. And this is the spot size that I use, 2 millimeter, 4.5, and 6 millimeter. When I check there, and then I use the lowest energy setting, the 0.2 with one pass. And then for the other part of the face, I use 2 millimeter for spot size to treat the dermal layer. And this patient also have some rosacea. And this is after 3 months and 6 months. So I use interval 1 month for these patients. And we could see that after 1 month, there's some 3 months, there's some like increase in volume in the temporal area. And if we check the temporal anatomy, it's quite different from the face, and there's a multi-layer like the dermis, subcutaneous fat, and also like I have deep temporal fat, and also have the temporalis muscles. So when I check, the temporal fat is increased. We can see from 0.8 to 2.2, and this is the 6 months is 2.5. So there's some increase in the fat layer. And then what I found is not only the fat, but also increase in the temporalis muscles. From the baseline is 3.6, 3.8, and 3 months is 4 millimeter, and in the 6 months is 4.3. And this is the other case. This patient also have some hollowness in the mid-cheek, and the patient need the tightening and have so the jowling in the lower face. I use this combination, multiple spot size, using for the cheek. So for the hollowness, I use 2 millimeter spot size and 4.5 to fight proliferations. And for the skin tightening, I use the 4.5. And this is the result after 3 months, only with one treatment. And this is also another case. The patient have a severe temporal hollowness and also have the skin laxity in the lower face. And this is after 6 months, after multiple treatment. So I use the interval is 1 month. And we could see there's some increase in the temporal hollowness. And I think the progress is slow, but it's natural. compared to injectables. So at the beginning, I tried to offer the injectables to these patients because it's quite severe for the temporal hollowness, but the patients doesn't want any injectables. So I tried the using the linear to 2 millimeter spot size and 4.5, and it increased with time. And the others, this is like older patients, 45 years old, and I use multiple spot size, and we could see there are some indentations in the temporal area, and for usually the patient also want the skin brightening, so I use the 2 millimeter spot size for the whole face. And this is the case that I have a long follow-up for 2 years. So I maintain this patient. This patient is 75 years old. So she have like indentations in the temporal area and the mid cheek, and also have the skin laxity. So I use the multiple spot size with the interval within 1 or 3 months. And this is the result. We could see there is some improvement in the mid cheek area and in the the lower face. The patient look a bit tightened and a bit volumized. And also sometimes I found like the case of the steroid atrophy from acne injections or like from topical steroid. Usually I use like for this case is come from abroad, so I use the linear one, 2 millimeter, to treat the steroid atrophy. I use 0.2, 1 pass, and this is after 1 month. So I have like skin analyzers that can create the 3D images of the image, and this is after 1 treatment, there is some improvement in this steroid atrophy. So in conclusion, I think now we have hope that not only the injectable, so we can increase some volume using the energy-based devices. With the high-intensity focused ultrasound, with the newer technology, we can choose like the right spot size, and we can customize the parameter. So which one, like for to increase the volume using the fat proliferations, which one for the skin tightening, and for which one for the lipolysis. And before I end this presentation, so if you have time, so next month we have exclusive JEISYS event in Bali. So I would like to welcome everyone. Please join us in Bali. And I will talk about the rosacea. I think it's also one of new exciting indications using a smaller spot size like 1.5 or 2 millimeter to target the dermal layers. And thank you for listening. I hope you are enjoying my presentations. Thank you very much.
Thank you. Thank you, Dr. Yuri, for the scientific and so insightful presentation about the linear Z. Yeah. So let's move in on the next session. Next session is myself for the Potenza, the RF technology. Sorry. We just covered 2 very sophisticated modality, density alpha and linear Z. Of course, this treatment is so effective. So next one, I will show you the optimizing and efficacy and safety of microneedle RF system. Okay. Please let me revisit the basic features of radio frequency as an energy source. Of course, we know the RF has tendency that easy to flow and difficult to flow according to the target condition. It is called impedance. It is a resistance to RF flow. The condition is not the same as each patient, of course. If we use the high hertz, the impedance will be decreased. It means the RF can flow very easily. And the water contents is some kind of problem. If we see the water-rich content, the impedance would be reduced, so RF can easily flow. And the temperature. If we add the heat to the surface or the dermis, the impedance will be decreased. That is why we can use the RF energy in a very efficient way when the temperature was high because the impedance is low. So the point is, avoiding high impedance tissue is effective to deliver desired heat energy. If you see the higher impedance tissue, you cannot penetrate the RF energy in an efficient way. It's kind of dangerous because you see the high impedance and if you use a high energy of the RF, it will create a burn. But the point is, avoiding high impedance tissue is not an easy task. So the point is how. In my point of view, using needle to skip the epidermis and emit heat energy is one of the appropriate answer to utilize RF energy. So, the next point is, all the needles are the same or not? Of course, you know the answer. The difference of the needle would be like this. The left one is non-insulated needle, but right one is an insulated needle, and these portions are only non-insulated. If you emit the RF energy, the result would be like this. With insulated needle, we can preserve the epidermis where we want to preserve. But with non-insulated needle, the RF energy will be distributed like this. We cannot preserve the epidermis in an efficient way. And the needle variety is very important. With potential system, we can use the insulated multineedle, semi-insulated needle, and cushion pump tip, and insulated single needle. This variety gives you the multiple indication to treat. Of course, we can use this insulated single needle to sedate the inflammation in each follicle. And if you want to use this one, insulated multiple needle, you can use the heat energy to tighten the tissue and to treat the sagging, of course. If you want to cover the thicker area in the dermis, you can use these semi-insulated needles. These portion and these portion are non-insulated. That is why we can use the double layered heat energy with microneedle RF with one shot. Single shot can emit double layered RF energy. And with cushion pump tip, this is a very important part because if you apply the active ingredient, of course PLA, PDLA, and tranexamic acid, this cushion pump tip is a very effectively suck the tissue and apply the negative pressure. And after emitting the RF, they will push the active ingredient like this. This is a very effective way to combine the RF energy and active ingredient you want. So, how to apply the heat with potenza would be the next question. Of course, we can use a monopolar and a bipolar at the same time with the system. Monopolar will apply heat like this, longitudinal one. And a bipolar, of course, we can cover the horizontal area because we can use the vectorized heating application, horizontal and vertical at the same time. And difference of the frequency is a kind of very important question. If you use a lower frequency, the heat will be dispersed. But if you use a higher frequency, you can confine the heat energy in a single area. You can use the heat as a heat sphere surrounding this area. And next one is the difference of RF pulse configuration. The left one, like this, 5 pulses per shot gives you a moderate heat temperature control. But if you use a one pulse shot, this gives you a rapid increasing in the temperature. I will show you the graph. If you use a one pulse, 150 milliseconds on, the heat will apply the energy to rise the temperature like this. It is a linear. But if you use a 5-pulse mode, the temperature will be up, down, up, down, up, down, up, down, and up. It will relatively constant and gentle energy application. For the coagulation, this single mode will be very effective. If you want to regenerate the tissue, this 5-pulse mode is very effective and safe. So, the most effective target of Potenza microneedle RF system would be DEJ, dermal epithelial junction, of course, and reticular dermis. I mean, the entire thickness of the dermis. We can cover all over these area. Of course, we can cover this area specifically, but we can cover all the area at the same time. We can choose it with the Potenza system. If you want to target the DEJ with insulated needle, the needle depth would be like this and emit the heat energy like this. You can cover specifically in the DEJ only. But if you want to target the dermis, and with insulated needle and monopolar RF, you can use the longitudinal RF energy like this. And of course, if you want to cover these areas, you can use the bipolar mode with the needle. And of course, semi-insulated needles got very good bi-layered heating energy in a horizontal coverage. Of course, we can cover shallower and deeper at the same time. But the one thing we have to concern about is the correlation between the coagulation volume, duration, and energy level. Even if you use the duration 50 milliseconds, the energy level 10, and if you use the energy level of 50, but the duration is the same, the coagulation volume is the same. If you elongate the duration with energy level 10, the same thing got the more and more larger area coagulation. The point is, the coagulation volume is depending on the duration and depth, not the energy intensity. This is a very important point to optimize the result with RF technology. Okay, I will show you my cases. This is a big millim on upper eyelid here. But this is so easy target with single needle mic RF using 2 megahertz because I need to confine heat and energy in a specific area only. And using 100 millisecond on, the relatively low energy got a very good result. And next one is mangioma, using, of course, 2 megahertz. Need to confine the heat energy, the strong heat energy in a vascular area only. And got very good result with one treatment session without causing depression. And this one, this is an inflammatory acne. So using multiple needle, 1 megahertz, monopolar mode, 25 millisecond on and 5 millisecond off with very gentle manner. We need to sedate the inflammation. We don't need to coagulate the tissue, but sedate the tissue. So regeneration energies are needed. That is why I prefer to use 5 pulses mode for these lesions. And next one would be the enlarged pore, here like this, using 5 pulse mode because I need to regenerate the skin. Regeneration is a kind of tightening the skin and flattening the skin and brightening the skin. And this one is grouping inflammatory acne using gentle energy, regenerative energy, moderate temperature rise. Got a very good result with one treatment session. This is the same. And these inflammatory acne and acne scar, it is a very easy target with microneedle RF. And this one, telangiectasia, we can use S25 because we need to go more deeper. But we need to cover more thicker area with one treatment session. Okay? So that is why I prefer to use S-tip. It is meant semi-insulated needles to cover thicker area with bipolar RF energy. And this one is a melasma. Of course, the lineage E and the density alpha, of course, and the density mono, it got a very good result for the melasma. Of course, the potenza can have a greater result to reduce the melasma. Using CP21 tip with tranexamic acid solution, we can sedate the inflammation and we can regenerate the ECM system at the same time. That is why we can provide a melasma treatment with a very gentle and safe way. This is a wrap-up. The Potenza system has unique needle on a pulse setting. It's easy to optimize efficacy and safety of microneedle RF to get multiple results. And when we want to maximize clinical results, knowing what the target is and where the target is and when to stop is the key. When to stop, not to rise the temperature rapidly. This is an important point. Gentle increasing the temperature is the key to regenerate. And combining CP tip and active ingredient like tranexamic acid, PLA, and any other ingredient you want can elevate the efficacy of the Potenza and patient satisfaction. And thank you for your kind attention. And okay, so let's moving on the Q&A session. And at the first stage of the session, do you have any questions from the floor to the excellent speakers? Okay, actually I have some questions. For the Dr. Yuri first, I think the adipogenesis and adipolysis is some kind of not an easy task.
Yes.
To get adipogenesis in here and adipolysis in here, maybe you need to combine your techniques. Please do share your treatment strategy with adipogenesis and adipolysis at the same time.
Yeah. Thank you, Doc. Check. Sorry. Yeah. Check. Okay. Yeah. Okay, it's working. Thank you for the question, Dr. Okay. I think it's a very nice question. So first, we need a marking. So usually I use a marking, which one is have a hollowness and which one is like the accumulation of fat or need the tightening. Usually for the tightening or the lipolysis, usually we see in the lower face. So we need to mark in the lower face, usually for the skin tightening or the lipolysis. And for the mid cheek, usually we have some hollowness. So for the hollowness, we need to mark with a different color usually. And then after we marking, we need to choose the right spot size. So our target is a deeper layer. So usually, if you have the portable ultrasound, so it's good to check with the portable ultrasound. So you can check the depth, and then you can choose the right spot size. But if you don't want, you don't have the portable ultrasound, so from the theory, so the subcutaneous layer is around 3 to 4.5. So we can choose that spot size. Usually I use the 4.5. And then if for the fat proliferations, I use the lowest setting, the 0.2. We know from the experimental study, we only hit around 40 degrees and it can regenerate the tissue. So we don't need very high energy. And then as we know from the effect of the temperature to the tissue, if we want to do some lipolysis, we need to increase the temperature into 65 degrees. So usually I use the higher energy, 0.8 usually for the 4.5. So for the lower phase, I use the 4.5 and using the energy 0.8. So to achieve the lipolysis, and usually the patient feel different. For the fat proliferations, the patient only feel the warm sensations, but for the lipolysis, a bit painful but still tolerable, and we can see a bit erythema. So I think that is my approach, which one for the skin tightening, lipolysis, and the fat proliferations. Thank you.
Thank you, thank you.
Sometimes do you combine with other agent for lipogenesis
Oh,
with HIFU?
Sometimes I combine with the PN, with the polynucleotide. We also have like some data that the PN can also induce the fat proliferation. So sometimes if the patient agree to do the combinations, but what usually I discuss with the patients the treatment cost. Usually the treatment cost would be higher. So if the patients agree with the treatment price, so I will do with the combinations. But if not, usually I use only the linear Z for the fat proliferations. Thank you.
In our basic research, what we have seen is that when we are using zero 0.1 joule or 0.2 joule at both energy levels, we have seen the activation of stem cells to start producing the fat cells. So the low energy is the key. Thank you.
Thank you, thank you. And for Dr. Kim, thank you for your fantastic presentation about the density alpha. And actually, I have a question about combination treatment strategy with density alpha and density high, or density alpha and density classic. How do you combine these tips to maximize the clinical outcomes?
Okay, actually, after the density alpha tip have been launched, I do not use density high tip anymore, but I sometimes combine with the density classic tip because the classic tip is, as you know, the conventional monopolar RF, that it's a strong effect. So, and we want the additional effect for overall skin improvement. So the both tips are combined. If the both tips are combined, I experienced the better effect. So as I told you, the 12-week course, I use both tips, the classic tip and the alpha tip.
Thank you. And after using the alpha tip, did you find something different between the covering depths with alpha tip and the classic tip? Do you find more alpha tip go more deeper or deeper?
I don't know about that, but I think that the depth is the same. I think that with the density classic tip, but the advantages of the alpha tip is the superficial layer.
Yes.
I think that each the additional effect, each safer than the high tip. So I use the alpha tip. Yeah.
Thank you.
Now, I've got a question for you as well as Dr. Kim. What we are seeing in the, based on our experience with the density high tip and density alpha tip, one treatment lasts for, effect is up to 6 months. Now, do you think that some of the patients who do not want to come back to the clinic after 6 months for the touch-up, do you have a strategy where you want to bring them back after 3 months and then increase the duration of the effect beyond 6 months?
Sometimes I use a 300 shot per treatment. So and the patient follow-up is very important. So first the 300 shot, and I recommend about 3 months after or 6 months after, I recommend the additional 300 shot and combine the classic tip with the alpha tip and the RF devices like the Potenza.
Yes, for me, of course, the patient education is very important. And combining alpha and high F would be the great. We can provide more and more result with this combination. But after the 6 months, the patient face will differ. With alpha tip, we can go more deeper. So shrink the face, and the result will last at least 6 months. But the skin laxity is not the same. So providing the high F, more and more high F tip shot, less alpha tip shot, maybe in the session 2. But in the session 1, the more and more alpha tip shots and less high F tip shots. These difference between session 1 and session 2 got a greater result, and the patient keep coming back to your clinic, I think.
Thank you.
And is there any questions from the floor? Okay. Please give the big applause to the excellent speakers. And thank you for coming to the session.